we have the tower diagrams. While describing the imbalanced states, we need to understand the terminology used so that the treatment aspect becomes clear to us. It would also help us to understand the dynamics of the interrelationship of yin and yang and their extensions. So we have the figure below, which shows the extended picture of yin and yang. First, we have the blood, the yin, the yang, and qi. This is the common terminology in traditional Chinese medicine, and it has long been my wish, sabi ng author, to put this into 4 towers as I first did with yin and yang. I believe that if one can see the imbalance, one can treat it better, and that each imbalance has a specific way of being balanced. It is important to understand the rules. The rest is easy. The most difficult part of our job is to make the correct diagnosis, to make the correct picture of imbalance. In the illustration above, the yin and blood are both the extension of yin, and as are yang and qi. But they are not the same. The imbalance in each of them cause different problems and should be treated differently. An understanding in this will make a world of difference of our understanding of TCM and treatment with acupuncture. So first we have the blood. The blood stands for red blood, and if there is sufficient blood elsewhere. Blood also means nutrition, without which any organ or tissue cannot continue to function and would soon become exhausted. As blood also moistens tissue, a blood deficiency would cause a lack of moisture. As blood is also a thick fluid in the body, it can cause or lead to dampness or stagnation. Next, we have the yin, which is the amount of water and thin fluid that irrigates an organ or tissue. Yin is also the substance and structure of an organ or tissue which shrinks or collapses without continuous supply of blood and fluid. Yin has the ability to cool the organs and tissues of the body. A yin deficiency would cause dryness and heat symptoms. Next, we have the yang, which is the warmth that can bring blood and energy flow to a part of our body. Warmth helps to accelerate function of organs, without which they would slow down. Yang deficiency causes coldness and cold-related symptoms in the body. It would also cause retardation of the function of the organs. Next, we have the qi, which is the functional part of the yang, which is necessary for every organ, so it can perform its role. The functions are circulation, dispersion, elimination, and absorption, blood synthesis, firming, and holding. A qi deficiency in an organ can cause stagnation of fluid or blood flow, or it could result in a retention of stool or water. It would produce malabsorption symptoms such as diarrhea after meals or diabetes mellitus. Some blood, if there is a deficiency, can cause paleness, dizziness, numbness, which improve with activity, weakness and tiredness following work, poor memory and sleep, and blurred vision. So yin deficiency causes dryness and heat symptoms such as hot pain, hot flashes, restlessness, night sweating, and low fever, tachycardia, etc. If there is a yang deficiency, this could cause coldness, cold pains in muscles and joints, cold disease in the interior, paleness, and some clamminess, all symptoms that improve in a warm climate. Sa qi naman, besides symptoms of stagnation and retention, qi deficiency can also cause leakage symptoms such as cold, sweating, incontinence of urine, or stool. It can also it can result in a loose connective tissue and muscle, cause sagging, skin, or prolapse of internal organs.